stage. Now with your BMI, your body mass index, you can take the height and weight and figure out what the BMI is, and then assign the code for that. Now the doctor has to state that the patient is obese or morbidly obese or underweight, but you can assign the BMI. If there's conflicting information in the medical record and what your clinician says, you're always going to have to query the physician for further documentation. The BMI codes only need to be secondary codes. They don't need to be primary, and should only be assigned when they meet the definition of a reportable additional diagnosis. If the patient has a normal BMI, there's no reason to put it on every chart. Syndromes. Following the Alpha Index guidance when coding syndromes. In the absence of alphabetic index guidance, assign codes for the documented manifestations of the syndrome. Additional codes for manifestation that are not an integral part of the disease process may also be assigned when the condition does not have a unique code. Complications of care. Code assignment is based on the provider's documentation of the relationship between the condition and the care or procedure. Your physician will have to correlate the complication with the procedure. Now, we all know that the physicians really don't like to do that. That affects their outcomes. But it may be very obvious to us that this is a complication from a procedure, but the physician has to state that. The guideline extends to any complications of care regardless of what chapter it's in. Not all conditions that occur during or following medical care or surgery are classified as complications. There has to be a cause and effect relationship between the care provided and the condition, and again, the physician must correlate the two. If you have any questions and feel strongly that this is a complication, you'll need to query the provider for that clarification. Borderline diagnosis. If the provider documents a borderline diagnosis at the time of discharge, the diagnosis is coded as confirmed unless the classification provides a specific entry, such as borderline diabetes. If a borderline condition has a specific entry into ICD-10, it should be coded as such. Since borderline conditions are not uncertain diagnoses, no distinction is made between the care setting, whether it's inpatient or outpatient. If we have any questions, again, we query the provider for further information. Use of sign, symptom, and unspecified codes. We talked a little bit about this earlier. Specific codes should be reported when we have that documentation. Signs, symptoms, or unspecified codes are sometimes the only choice we have. We don't have any further documentation. We may not get a very good referral. We're going to code it to the highest level of certainty that we know. If a definitive